Hello, everyone. My name is Catherine and I work with public health here in Worcestershire. With me today is Dr. Catherine Cobain, who is the Director for Public Health here in the county. Hello, Catherine.
Hello, Catherine.
We've been asking people to send in questions, Catherine, as you know, to put to you. I think as we've gone into tier 2, there's lots of questions, and I'd like to get started with you and see if you can help answer some of the queries from the residents of Worcestershire. The first one is a question about adult ballet classes, so adult exercise classes. Can I teach them in a COVID secure business now we're in tier 2?
Okay, thank you, and thank you for the question. Indoor exercises classes can indeed take place in Tier 2 under strict regulations. They can only take place if it's possible for people from different households to make sure that they're not mixing, to make sure that they're socially distant. Now, the government has clear guidance on this and the measures necessary. So I would direct the person asking the question to the .gov site for a full list of the necessary requirements to run the class. If you're not able to ensure your class attendees can keep their distance, then the class really should not run. So good luck with that.
Okay, thanks, Kath. Another question. Can a family from a higher tier come to stay over the Christmas period?
So over the Christmas period, a family from a higher tier can come and stay. Now that's a very specific period of time. It's from the 23rd to the 27th of December. If you're traveling back to Northern Ireland, if I was going back to Northern Ireland, for example, I would be able to go from the 22nd to the 28th because you have to get on a plane, etc. But yes, they can. You should consider, though, everything you do is a risk and it's adding to your risk. So make sure that you're being as careful as possible you can do. The virus has not gone away. This is not a risk-free situation. It is very much about enabling you in some way to see friends and family over the Xmas period.
Okay, so now we've got a question about pubs and restaurants. Obviously, we've come out of lockdown and the restrictions are changing a little bit in tier 2. So the question is, are restaurants and pubs with meals going to be compliant in only allowing diners to eat with their bubble?
Okay, it's a very good question. All premises and businesses have a responsibility to be operating safely and within the law. If you're concerned about a business or restaurant, pub, etc., flouting the rules, then you can either let us know in public health, and we've got an outbreak response team there in place between 9 to 5 every day, and an email for out of hours for notifications, or you can contact regulatory services. It's important, really, I think, to accentuate here, we all play a role in this. In keeping premises safe. We need to make sure these rules are for businesses and they're for ourselves to keep us safe. If we visit a pub or a restaurant, we should only in tier 2 be visiting that with our household. We shouldn't be putting pubs or restaurants in difficult situations and where we're presenting with friends, etc. So I think it's really a joint effort there, but please do report anything that you are not happy with. And ultimately, you're the customer. If you don't feel safe in that space, you leave. I think that's it. That's the ultimate, control measure there for you to be able to leave.
This goes back to choice again, doesn't it, Kath? Making sure that we're all making the right choices for ourselves and protecting ourselves and others. Let's go on to a question about shielding. This one is asking about, now that we're in tier 2, what happens to those people who've previously been shielding? Now we've moved into this new tier of restrictions.
Okay, really good question again. So shielding ceased to be a thing. It's now, you will know if you are clinically extremely vulnerable. And it's really important that that you are able to do things, you need to follow the guidance of whatever tier that you are living under. You know, the government is continuing to, and I would support this, to make sure you think carefully about what you're doing, who you're doing it with, where you're mixing. Make sure you're keeping 2 meters apart, wear a face covering, wash your hands regularly and thoroughly. I'm sure you are, particularly if you've got a condition that you know puts you at greater risk. You will be having that at the back of your mind. I know you will, but it's important that you feel able to get out and about as well. So it's about balancing that risk. So if you need, and particularly if you need help with self-isolating, or you help around sort of feelings of loneliness, etc., we have a Here to Help services offering support where needed. And also the .gov website again has got some really good detailed advice on there for people who have been shielding and are clinically vulnerable. So I would direct you there, and really good luck with that, and look forward to being able to do some more things, and really sort of you know, being able to get out and about as well, but to do it safely. And I know you will be thinking sort of and appraising that risk all the time.
We've got quite an unusual question now, Kath. I haven't ever seen this discussed before, but perhaps you can throw some light. On dining pods, do they count as being indoors or outdoors? In other words, can you meet people from a different household in a dining pod?
This is a really good question, and it really did, you know, it does that kind of make me think, what is a dining pod? What are they? You know, it's not something I've experienced before. So we have looked into this, what a dining pod is and what we believe that pod is, and you know, there's lots of innovation going on through this pandemic as well. But in looking at it on face value, this really does, Catherine, look like it is an indoor space. And no, we cannot in tier 2 meet from different households in indoor spaces.
Okay, that's a very straightforward answer to what was quite an interesting question. Next, and again, this is one that particularly workers may well recognise as perhaps a dilemma. Are groups of people who are on a training course that includes lunch able to sit at the same table?
Another interesting one. And you know, I suppose if we were doing this online, I'd be asking a few more questions on this as well, because we have had some workplace outbreaks that have been related to sharing food in workplaces, particularly in kitchens or buffet style. However, I think here I'll assume that it's a normal lunch given out in a lunch setting. No, you shouldn't be seated at the same table. You need to stay socially distant, 2 meters apart. And I know this is a painful thing really as well, because we all like to sit down and chat and things like that there, and laugh, and all these things increase our risk. So I think you need to be really proportionate in this, and it doesn't feel very comfortable, I know, but we need to stay socially distant, because we find in businesses and in other settings that it's not really being at work, it's being sociable with the people while you're at work. So it's those break times that are really the risky times. And obviously we have had quite a few outbreaks related to buffets, and you know, I know as we come up to Christmas and New Year period, we desperately all want to kind of feel like we're sharing in something. So we need to work out other ways to do that, because they are riskier things to be doing.
Staying with work situations, we've got a question here about those who are clinically extremely vulnerable, and what are you doing to protect frontline workers that are in the tier 2 and the tier 3 areas?
Okay, well, people who are clinically extremely vulnerable know who they are, and they should be telling their workplaces, their employers, who they are, to make sure that that comprehensive risk assessment is done. To, you know, obviously each each case will be different, and I think that's why it needs to be an individualized risk assessment. Speaking generally, our frontline workers, we have really good processes in place in Worcestershire to make sure we've got enhanced infection prevention and control advice. We've got supplies of personal protective equipment, PPE, and making sure people have the knowledge and the skills to follow the guidance that they need to make sure that they're lessening their risk of catching the virus by wearing PPE, for example, appropriately, and they're also lessening the chance of them spreading coronavirus to those residents and vulnerable people that they're serving. But I think if the question is around clinically extremely vulnerable, I think if you're concerned, speak to your GP, who will know your clinical details, and obviously speak to your employer. If you're not getting satisfactory from that, I'm more than happy to look at the case. But really, it's the employer and your general practitioner that will be able to help most in this.
Okay, we're on to travel now. So there's a question here: can a family from a tier 2 area, so Worcestershire, go and stay in a tier 1 area?
Yes, absolutely, they can over that Christmas period. Not at any other time, but during that Christmas period, as we said before, that's generally between the 23rd and the 27th, or 22nd and 28th if it's to Northern Ireland.
Okay, and some Christmas questions now, just to finish. We have two. The first is, if you have created a Christmas bubble to meet inside, are you also allowed to meet others outside following the rule of 6? In other words, can I spend Christmas with my family and then have drinks with my neighbours outside?
You're very sociable. Let's talk about what we can do and maybe what we should be thinking about what we do. So over the Christmas period, a fixed bubble is essential and proportionate to you've got to balance the desire between wanting to see people and your risk of catching coronavirus. So I think it's really down to you to kind of to do the maths on who you're seeing and what you're doing. So you can indeed have your set bubble of 3, your Christmas bubble of 3 households. You can only be in one bubble, so you shouldn't mix and match. You shouldn't be changing that bubble, and you can only travel between the tiers for the purpose of meeting in your Christmas bubble. But you can, because we are in tier, you can meet up to 6 people outside as well. So but I would just caution you to think, when you're meeting people outside, you haven't completely annihilated the risk of catching COVID-19. You need to be careful. Embracing people, getting close to people, hugging, embracing, kissing them is a potential way that you can let the virus in. So it's really important that you first of all think, do I really want to increase my risk? Obviously the risk is lower outside, but as long as you stay socially distant, the social distancing doesn't go away. So just think, what am I doing? Who am I with? And how important is that to me? And really do want to limit your chance of catching COVID-19.
And one final question, still on the theme of Christmas, Kath. If you want to go and see elderly or vulnerable relatives over Christmas, when should you start self-isolating, and should you have a COVID test before you go to see them?
Okay, so it's a good one again, and we're talking again about balancing risk, aren't we? And balancing our our needs and desires to see people socially. And basically, when you're going to visit somebody who's either elderly or older who has a condition that makes them more clinically vulnerable to COVID-19, this takes on a different element, really. So the important things for you to think about is balancing the risk between the person and the that you might that person of actually giving them COVID-19. So basically, I would advise reducing any unnecessary contact in the kind of 14 days leading up to when you're due to see the person or stay with the person, to make sure that you are reducing the level of risk that you would be introducing to that person, because everybody you see and you're in contact with before you will have had the potential there to have passed on coronavirus. So if we can, particularly, if you've got, we should continue our normal lives up until that point. I think it's important to say that. So children need to go to school. We obviously need to pop to the shops and things like that there. But if you can reduce your contacts in any way up to that point, that will all stand in good stead for being of lower risk to that. Now, we can't eliminate the risk. None of us can eliminate the risk. All we can do is keep an eye on it and do what we can do to put ourselves in a better position to enter into the Christmas period when there is relaxations there. So I think it's just important to think it through and to do all that you can in that period running up to it. Now, there's no need to have a test for COVID-19. So obviously a test gives you a point in time a picture anyway. But if you do have symptoms of COVID-19, please get a test. We've got really good availability in all of our testing sites. We've got 6 testing sites now, 1 in each of the districts in Worcestershire. So you should be able to get one that you can get to easily. I've been told lately that you can book on within a couple of hours and you usually get the result back the next day. So it's quite a slick procedure. And you need to isolate as well if you've had the symptoms, and do not travel and see somebody, particularly if they're elderly or clinically vulnerable, if you think you may have coronavirus. But good luck with that. I know it is a difficult thing. You probably, I can tell from your question, you're thinking through balancing the risks and making sure that you're reducing those risks as well. So that's really good. Thank you.
Good, thank you, Kath. There's lots of questions there with lots of talking points. Thank you all as well for the questions. We've really appreciated having those in. I think, Catherine, we're going to do another one of these before Christmas. So we'll invite you to send in your questions to Dr. Catherine Cobain, and we will do another question and answer session in the run up to Christmas. But in the meantime, thank you very much for your questions. We hope it's been useful.
Thank you.